Hey everyone, it's Reena Jadhav with the Live Longer podcast and Health Boot Camps here with Dr. Brian Mowll, answering the question that came in around my diabetes is out of control. Dr. Mowll, what do I do?
Yeah, this is a scary situation, and out of control to me means one of a couple of things. It means either your blood sugars are very high all the time. So sometimes we see patients and clients who have a blood sugar of 200 or 300 or more, and that can be very, very serious. So if that's the case, it is cause for concern, and we want to address what to do about that here in just a minute. There are also cases that are sometimes called brittle diabetes, where we see the blood sugar regulation is all over the place. So they may have a blood sugar of 200, and then 2 hours later, their blood sugar might be 60. And so these are up and down, and it becomes a big issue. So that to me is all out of control. And when we have a blood sugar that's all over the place, or a high blood sugar, or a blood sugar that's no longer responding to maybe the medications that you could be taking, we certainly need to do something about it. We don't want to leave that unchecked for very long. So first thing I'll say is if your blood sugar is in fact out of control, you need to check in with your primary care physician or endocrinologist right away, because you have to get that back under control. You may need a course of insulin, or you may need to adjust a medication if you're on medication. I think these things need to be addressed, and they're very important. But we don't want to just leave it there. We want to try to find out why it got out of control and how we can get back into control. The number one reason why people's blood sugar gets that way is an inconsistent diet and or inconsistent physical activity. But the diet is the big one. So if you are eating all over the place, one day you're eating, maybe you're not eating at all, you're skipping meals, or you're eating a low-carb diet, and the next day you're having a pizza, or you're having a sandwich for lunch, or some spaghetti, or something like that, which would be considered a high-carb meal, and you put that into a system that cannot control and regulate blood sugar very well, you're asking for trouble. So the thing that I recommend most for people who have out-of-control blood sugar after you've brought it down to an acceptable range is to get your diet very, very consistent. In fact, sometimes we'll put people on the exact same menu plan for a week straight. You eat this for breakfast, this for lunch, this for dinner, and do not vary that at all until we get this under control, because you want to take out as many variables as possible. So the first thing I would say is absolutely check in with your doctor, make sure you get out of danger, and then we need to start to work on why is it out of control and how can we get it stable, and that starts with a really good, consistent diet. I'll mention one other thing, which is sometimes people get low blood sugar episodes, and they get worried about that for good reason. So they start to see their blood sugar drop, and maybe it's in the 60s or 50s or 70s, and they start to become lightheaded and thirsty and irritable and dizzy. These are signs of what's called hypoglycemia, and that can show up for a couple of reasons. There's something called reactive hypoglycemia, which typically happens in people who haven't yet fully progressed into type 2 diabetes or don't have type 1 diabetes, and they just have a hard time keeping their blood sugar up. For those people, again, a really consistent diet is helpful, and that's a case where I recommend eating maybe more often. So try to always stay in the fed state, which means you're eating about every 3 to 4 hours, and putting in a nice trickle of food throughout the day. For people with type 2 diabetes, I don't typically recommend that eating strategy, but if you have low blood sugar episodes, you're having a hard time keeping your blood sugar up and stable, that can be really effective. And again, don't get tempted to eat lots of sugar every time you have low blood sugar episode, because you're going to actually be accentuating the roller coaster. You're going to have really high highs and really low lows if you keep doing that. So you want to do a really consistent low to moderate carb diet and be eating frequently. Now, if you're getting a low blood sugar because you're taking a medication or injecting insulin and you have type 2 diabetes, that's a different story. And there we need to, again, send you back to your doctor, make sure you're working with your doctor on adjusting your medication. Learn to properly dose insulin, learn to adjust your medication so that you're not going too low, especially if you're making health changes like you're eating a better diet or exercising and you're noticing sometimes your blood sugar really drops. It usually drops in those cases due to over medication. So you may need to talk to your doctor about adjusting that.
Wow, that's such incredible information. And, for those of you who are worried about your diabetes being out of control or not, make sure to check out Dr. Mowll's Health Boot Camp, the Beat Diabetes Health Boot Camp, because that's where, to your point, Dr. Mowll, where you said, well, we want to put you on a consistent meal plan. That's what you get. You get a consistent meal plan that's been designed with the help of Dr. Mowll, as well as workouts and meditations. And Dr. Mowll has some amazing, amazing resources on that boot camp to help you, either reverse or treat or prevent diabetes. So definitely make sure to check the Beat Diabetes Bootcamp out. And we're going to keep recording these answers to your great questions. So keep sending them in, and we'll see you on another one of these segments. Thanks, Dr. Mowll.
Thank you.